Environmental pollution and climate change are aggravating non-communicable diseases across Europe. To address this, 7 Horizon Europe projects have joined forces under the ExpoHealthNet cluster. By combining clinical research, data science, and policy engagement, they aim to translate scientific discoveries into concrete actions that protect public health and shape environmental policy.
We are Marco Polo.
We are Apprise.
We are Climer.
We are Envisome.
We are Enact.
We are ExpoSignals.
We are ExpoSig.
This document each representation.
The acronym Marco Polo stands for Markers of Pollution. So therefore we are interested in markers that are induced in the body by exposure to pollutants. But of course the acronym has a double meaning because it's also related to the famous discoverer Marco Polo, and we want to discover new scientific ground related to environmental exposures. So therefore Marco Polo is interested in ultrafine particles exposure, traffic noise exposure, and the combined effect of both of them. And this we will study in mainly the brain, the lung and the heart.
Apprise aims to investigate how the ultrafine particles and micro nanoparticles during pregnancy affect the correct development of the fetal. To achieve this goal, Apprise implement multidisciplinary approach so that include epidemiology, toxicology, public health, and other disciplines such as epigenetic and transcriptomic.
Climer is a project that focuses on the application of artificial intelligence technologies to identify the correlations between air pollution, climate change, and non-communicable diseases, specifically asthma and allergic rhinitis.
Envisome is trying to implement a very thorough exposome-based methodology to address emerging environmental concerns on public health and actually individual health, following a comprehensive strategy of incorporating advanced exposomic analysis, advanced sensors, remote sensing, data fusion, all the way down to multi-omics analysis and mechanistic understanding of specific pathways, including both human and in vitro data analytics, and eventually using also big data analytics and AI to actually derive new opportunities for health-based risk assessment.
Our project has 2 important phases: an exposomic study at population level through a retrospective study. We also have a study at the individual level through prospective studies. Our core research areas focus on environmental stressors such as air pollution, urban noise, humidity, and emerging risks like electromagnetic fields and light exposure. These exposures are increasingly linked to non-communicable diseases, including cardiovascular, respiratory, ocular, dermatological, and neurological conditions, which together account for 80% of EU's disease burden. Through epidemiology, exposomics, clinical data, and AI, and with 5 pilot sites in Belgium, Bulgaria, Italy, and Spain, Enact maps the pathway for exposure, from exposure to biology to disease.
So the goal of ExpoSignals project is to understand the role of chemical pollutants in the incidence of Alzheimer's disease. And we want to understand if in patient who has a preclinical stage of the disease or who are in the early phase of the disease, if there is some typical signature in their blood or in their hair. And then we will study this signature in various models to understand the mechanism of action of these pollutants.
ExpoSig focus on studying environmental stressors that can impact on immune system. We will focus on general population that is exposed to environmental stresses as noise, air pollution, and others, and what is the impact on the immune system, studying the biological mechanism that can result in disease.
Working Group 1 is dedicated to science for policy. This is a very important topic within the cluster because we aim at developing new documents and tools to inform more efficiently the policymakers and other stakeholder decision makers.
I believe that in this area where we are talking about risk and health and pollution, or actually environment as such, okay, there is a lot to do. Data is already not linked, okay, and actually the effects in health are quite high. So I believe that there is a space to actually be able to get something in the direction of prevention, okay, of many of these diseases that are also impacted by the pollution. Like 80% of many of the non-communicable diseases are already impacted by that, so it's a lot to do in this area.
So we will, at the level of the European Union, definitely approach representatives of the European Environmental Agency and in discussion with them develop these documents for policymakers. We will also seek information from EEA, for example, on the policy cycle. So therefore, what is of special interest for the European Union Parliament at the moment with respect to environmental exposures. And at the level of health professionals, we will approach the scientific societies.
I believe we all would like to achieve, okay, not only to have a very good healthcare system, but actually not only patient-oriented, but really care about all of us as patients as such. And I believe that if we go with all our objectives and goals, in an ideal world, we could have quite a balanced, value-based system where actually what we get through the health system is not only health but wellness, okay, and it's the value of being for a long time here.
The main focus of the working group is to create the infrastructure for appropriate data management, handling, and eventually processing across the different projects in the cluster, so as to create a comprehensive data infrastructure for environmental health and exposome research in Europe. Primarily, the idea is that we follow and adhere to FAIR principles, of course following all the GDPR regulation in terms of ethics and data protection. But more importantly, I think what we're trying to do is to create this culture of sharing in a federated manner, so that we can actually do indeed pooled data analysis work without infringing upon any kind of ethical, privacy, and also even national regulation.
In the ExpoHealthNet cluster, we have a total of 7 projects. These are representing 107 different organizations from 27 countries. And bringing so many different groups together, projects with different topics, our working group will help to align the common message throughout and hopefully maximize the impact through disseminating results and outreach. This will help raise awareness.
Being part of a cluster enhances the abilities of a project and the overall value for the entire cluster. First of all, it's a very good use of taxpayers' money, because it coordinates and it makes sure that there's no overlaps. And also projects can build on each other's data, results, samples, methods, ideas, and ultimately the expertise that is in each one of the projects.
One of the important aspects we see in this effort of the clusters is to harmonize the approaches to make the data more fair, so more findable, more accessible, more interoperable. So this will have a great impact in future research activities. It will increase the access to the data. It will increase the harmonization of the data, so it will be easier to use for other institutions in the future, for future research projects. So that is an important aspect.
The clusters can do a great job in terms of promotion and outreach of the results. They can create extensive networks, not only among researchers, but also with policymakers and societal actors. It is much easier for clusters to do this. There are economies of scale that they can use that go beyond what individual projects can do. And so that hopefully will have a more lasting effect. The European Union has worked in that sense, in that direction, so that research that is funded by the EU can live beyond the life of the projects, and hopefully with clusters that can go even further beyond.
Together, through scientific innovation, robust data governance, and policy-focused collaboration, ExpoHealthNet is poised to deliver actionable solutions that reduce the health burden of environmental exposures. Explore more at expohealthnet.eu and join us in shaping healthier, sustainable futures across Europe.